Hi. While we continue to work on some important deep dive videos for you, I thought I'd pop in and bring you up to speed on 4 newsworthy stories. I'm going to start first with some bad news. Father Stan Swamy, the tribal rights activist arrested in the Algar Parishad case, died this afternoon. His lawyers had moved the Bombay High Court this morning, seeking an urgent hearing on his medical bail plea after his health deteriorated. During the hearing, doctors informed the court that Swamy, who was 84 years old, suffered a cardiac arrest on Sunday, was put on a ventilator, and passed away around 1:30 in the afternoon. Now, he's said to be the oldest person accused of terrorism in India. This is the Algar Parishad case where Swamy, along with others like Varavara Rao and Sudha Bhardwaj, were arrested and charged under the very stringent UAPA. As the law allows, his bail was repeatedly opposed by the state, denied by the courts. This is despite his age, comorbidities, a pandemic, and visibly deteriorating health. The loopholes in that case are a story for another day, but I'd strongly urge you to head over to our IGTV on Instagram or our YouTube playlist and see the 3-part series on UAPA, a law where the process is often the punishment. If this has been worthy, do consider supporting our work. The link for that is in the bio or in the description. Let's move on to the second newsworthy story, and it's the Delta variant. The dominant strain in India as of April is well on its way to becoming the dominant strain of the coronavirus across the world. In 70 of the 85 countries it has spread to, cases are rising. Russia reported its 5th record for daily COVID-19 deaths in a row on Saturday. Indonesia has imposed a partial lockdown after reporting more than 25,000 cases and 539 deaths. Both are new daily records. Myanmar has ordered 2 million people in Mandalay to stay at home as that coup-hit country is struggling to contain a spike in cases. In neighboring Bangladesh, they're mulling a lockdown after recording their highest single-day tally last week. Experts attribute it to the highly transmissible Delta variant. Iran, it's likely to witness its 5th wave of COVID-19 thanks to the Delta variant. Fiji, which went an entire year without recording any community coronavirus cases until Delta arrived in April, has recorded its biggest ever infection increase. In fact, infection numbers have increased in the African continent for 6 weeks running now, driven by the Delta variant. Germany, Belgium, France, all are seeing a spike in cases driven by the Delta variant, of course triggering concerns across Europe as countries are now rethinking their plans of lifting COVID-19 restrictions. Israel, a country which has inoculated well over half of its population, has reimposed indoor mask wearing after a nearly 6-fold rise, thanks to the Delta variant. Now, what's different is countries like the US, the UK, and Israel, they're not seeing a proportionate rise in hospitalization and deaths due to their high vaccine coverage. Whereas in poorer countries where vaccines are still in short supply and perhaps out of reach for many, the new variant is leading to a loss of life and once again overburdened healthcare systems. Our best shot at not being in this position again with the Delta Plus or any other variant for that matter is to vaccinate, vaccinate, and vaccinate. All major vaccines available work even against the new variant. We have now enough data to say that. This brings me to the third newsworthy story. It's a vaccine update with a specific India focus. We do know pregnant women are eligible to be vaccinated here in India. Any of the available vaccines in India are now being considered safe for them. The center, in a sense, has fallen in line with what doctors and experts have been saying for a while now, that vaccination for pregnant women is essential to protect the woman and the fetus. As far as supporting data goes, that many of you have been asking us for, Well, we don't have it yet for all the vaccines. Covaxin, Covishield, and Sputnik were not tested on pregnant women. But scientists have actually gleaned relevant information from ongoing studies of these vaccines, plus safety data of those who have already been immunized, and they've added comparable vaccines that have been around for much longer with tried and tested technology and are known to be safe for pregnant women. So, net experts and the center have now concluded that the benefits increasingly outweigh the risks. India's fourth vaccine, which is Moderna's mRNA vaccine, has been given to enough pregnant women in the United States over the last 6 months or so for scientists to deem it safe and effective. Now, Moderna's vaccine should be available in select hospitals in India, and that's going to happen only around mid-July, according to a report in the Economic Times. They have to give the vaccine to 100 people. They have to then submit the safety data, get a green light from the DGCI before rolling out the vaccine on a much larger scale. It's also important to note that the vaccine is most likely going to be available only in private hospitals, given its higher cost and a very specific storage need. Pfizer's vaccine, which is also in the final stages of approval in India, is also an mRNA vaccine. It has been administered to millions of women pregnant, lactating, and otherwise safely. Another vaccine that's pending approval from India's drug regulator is Ahmedabad-based Zydus Cadilla's vaccine called Zy-Covid-D. If approved, it's going to be the world's first DNA vaccine against COVID-19. Well, it's been tested in phase 1, 2, and 3 clinical trials and has involved over 28,000 participants in all. 1,000 of these were between the age groups of 12 to 18 years. Now, if this gets approval, it will be the first vaccine in India for children in this age group. The vaccine consists of 3 needleless doses given through a jet injector. According to the trial data so far, the vaccine has an efficacy rate of 67% in preventing symptomatic COVID. The final story, it's a diplomatic one and a familiar blame game between India and Pakistan. On Sunday, Pakistan's National Security Advisor, along with their information minister, accused an Indian citizen of orchestrating last month's car bombing near the Lahore residence of 2008 Mumbai terror attack mastermind Hafiz Saeed. It killed 3 people and left 24 injured. Pakistan is claiming it has forensic proof. It is certain that Indians were behind that attack, and that the whole drama about the mysterious drones flying in Jammu and Kashmir was just a deflection tactic. What drone thing, you're wondering? Well, on the 27th of June, there were 2 low-intensity blasts triggered by IEDs or improvised explosive devices. They were carried out by drones at the Indian Air Force Station at the Jammu airport. This was actually days after Prime Minister Modi met leaders of Jammu and Kashmir for the first time since August of 2019. Now, this was a relatively minor attack, but a significant security breach, given how it was the first time that drones had been used to direct an attack. Since then, reportedly, other drones have been sighted even along the international border. New Delhi and Jammu and Kashmir's police chief have suspected the role of the Lashkar-e-Toiba in the twin attacks. We're going to leave it there. There isn't much coming in right now, but this is a developing story and we'll keep you posted. If you've been watching so far, thank you so much for your time.